Welcome to This Week in Washington for Friday, November the 9th, 2012. Now that the elections are over, Congress is planning to return next week to address the unfinished business of this year, dealing with the financial and debt crisis the nation faces, unless they come to an agreement with the administration on a series of reductions in spending and increased revenue. There will be automatic cuts across the board called sequestrations in almost every federal program and activity. This, of course, affects much of the important work that's done by community and public transportation, but it would include everything up to and including the way we finance our country's defenses. So it has significant impact. If you notice, the day after the election, the financial markets seem to have recovered their memory and decided to react negatively, in part because of their concern about this struggle over the end of the year debt crisis. This situation was created by bitter partisan politics. It's our hope that the election may signal a new opportunity for the administration and its adversaries in the Congress to work together. It's obvious that the president returns to Washington in a much stronger position than he was before he left, so it will be interesting to see how these issues are resolved in the days and weeks ahead. We'll be trying to keep you informed of these developments and how they will affect our important programs and the important issues that we face in the human service programs that provide for transportation. I doubt there's going to be much that anybody can do to influence the outcome, but we're going to do our best when our programs and our priorities are in conflict with what's going to happen. So stay tuned, and as I said, I'm not very sure there's much people can do. We're just going to have to see how this evolves, and then, given the opportunity, comment on the issues that affect us most. Looking beyond the end of the year, the outcome for the election improves two issues that are very important to us. One, it's my theory and the theories of others. It should give us a good opportunity to once again remind the new Congress and the administration of the unfinished business in MAP 21. As people become greater aware of the situation in the infrastructure issues in transportation, we think they'll have greater desire to do something about the numbers in MAP 21. This is especially important on the job side of the highway program. So I think we have a chance to maybe join with others and remind people that MAP 21 is a very short-term piece of legislation, and now is the time, past the election, to make some compromise, bipartisan efforts to get a better transportation bill that serves the long-term interests of the American people. I think there's probably a better chance on that than there was before the election. On the other side, the re-election of President Obama means that the Affordable Care Act will be moving toward full implementation in 2014. Next year, 2013, is very important to us because that will be the period where policies and issues will be hashed out for the final network of programs and services that will be put out beginning in 2014. We're very concerned about these issues, and among those that are really at the core of our concern are the following. The affordable health care programs, as Medicare and Medicaid have shown, will be driven by price. The goal of the administration in the Affordable Care Act will be to produce the most affordable costs for services that they can obtain by deep discounting the actual costs for healthcare services. This will be extended into the transportation side of the medical programs as well. Additionally, gatekeeping or intermediaries or brokers will be fundamental in the Affordable Care Act programs, and that means that insurance companies, because we decided that the private sector would have leadership in this area, will be the people managing the individual health care plans for people who are covered by the Affordable Care programs. In these environments, it is yet to be determined whether these companies will provide the transportation benefit under their control directly, or they will use an intermediary to provide the transportation for their patients. This means that insurance companies can contract directly with transportation providers, or they could choose contracting with an intermediary or a broker to obtain their transportation services. In all these cases, the overriding rule of avoiding conflict of interest will still be an important part of that decision-making process. And both the Congress and the administration and CMS have determined that those who manage the service cannot be those who provide it. And this isn't just a rule for transportation, it's a rule for the patient aspects of the healthcare system. So that system will be continuing to evolve in a regulatory format over the next 6 to 8 months. So those two factors will control an extremely important part of the transportation agenda. But it is important to remember that the programs under affordable care will expand significantly the investment in transportation to achieve good patient outcomes. So our task in the year ahead will be to remind policymakers here and regulatory writers here and in the states that community and public transportation is still the best deal, the most affordable way to handle the transportation issues, especially for ambulatory people and people who don't need a higher level of transportation than at any time in our history, and that we have an outstanding record in delivering low-cost, affordable services with a high degree of quality. So those will be the issues, I think, that we'll be trying to engage people in that affordable care process on, because it is going to be a challenge for us to get to the right place and the right balance that best suits our members and the people they serve. I know the last several years in this brokerage issue has been a challenge. We have lots of new ways to cope with this situation, and I hope that we'll be introducing some of them in the year ahead based upon the successes of many of our members with dealing with this situation. Starting later this month, you'll be seeing in our next issue of Digital CT Magazine a series of articles that will stretch forward into the next year that focus on the innovation of the people who provide services in our industry. And these innovators, who are really our leaders, provide affordable services but with a high quality, and in the process build constituent support for their efforts as well as political support. So the next year will be one where we gather our strengths and build to make a strong foundation for the changes that lie ahead. So we'll also be coming out soon with information relative to the elections and information to share about that. But I want to thank all of you who have been involved in the political process, and I am sure that it will be an advantage to us in the year ahead. So that's what I have so far for this week in Washington. I'll be in touch soon. Thanks, and again, thanks for all of your help and support. Bye for now.